Fisher.
Hello, Dr. Thompson. Good evening.
Good evening. I have an exciting new study to show you. We are looking at the fractal dipole organization of motor activity in individuals, especially those with major depression, as a potential treatment marker. So I'm just going to go over the basics with you, give you a preliminary view. So what we did is, again, we are looking at these potential motor changes as potential markers for treatment. So our study included 10 patients with major depression, as well as carefully age and gender matched healthy control individuals. In addition, all these individuals did not have medication for 3 months or greater, and they had no pre-existing condition. So the experiment is fairly straightforward, which I think is the beauty of it. We have 6 hours of monitoring forearm activity from 10 to 2 p.m. And then we analyzed our data with parametric t-tests between demographic data and then the Mann-Whitney t-test, looking at that those motor dependent variables. So we really measured the fractal exponent, the mobility, the activity percentage, and the rotation ability of the individuals. So the results were quite exciting. They did show a motor retardation in individuals with major depression, and therefore really showed an increase in that fractal exponent, and ultimately good indicators that we can use this as an, indicator of treatment efficacy.
Okay. Well then, thank you very much for that, Dr. Thompson. I'll go ahead and I'll take this. Thank you very much. Before I get into the review, I just want to applaud you for your work. I know you've been working very diligently over the past 5 to 6 years on this topic, this relatively groundbreaking research. So congratulations on that. There are a few things I just wanted to look at here. Okay. I see. Okay. The first issue I had. I believe your study may be undersampled.
Really?
Yeah, just because I know you mentioned you had a sample size of 10, so you had 10 individuals in your major depressive group, correct?
Yeah.
And then you had 10 individuals in your healthy group, correct? Okay. And you had significant results, correct? So I believe your significant results might be unsafe because your sample size is smaller than 16, which is usually the cutoff we use. So they might be insufficiently powered. So is there any response you have for that?
Yes, that's a legitimate concern. However, if you look at the careful control and matching of the depressive individuals and the healthy individuals, we again had age and gender matched. And so that really controlled for a lot of confounding variables that may show up. And so while it is, I do admit, a small sample size, it is carefully controlled overall. And the fact that it's small really guards against the type 1 error in contrast to a much larger sample size that is much more prone to that.
Okay. That's not always the response I get on that. So I applaud you for doing your research and knowing exactly what you're doing when you have a sample size that's smaller than that number of 16. It seems like you've really done a great job here so far. So, as I can see, yes, careful subject selection. The next issue though I had was, is your study and the population you used for your study, is it truly representative of your target population when you go to apply this to a wider population? I think you said your youngest subject in your study was 26 years old, is that correct? Okay, I know there was a study by Hugh et al. That was kind of looking at comparing younger subjects with older subjects, looking at motor activity, with some of the subjects having Alzheimer's, and the youngest subject they used in that study was 19 years old. Do you believe you could have used some younger subjects in this so you could have, you could make it more representative of the target population?
Normally, that would be a concern. However, There is a meta-analysis study by Paul Rhodes et al. As well, showing that there's a lot of neurobiological differences in the manifestation of major depression between children, adolescents, and adults, as well as their responses to treatment. So we really wanted to avoid potential confounding differences in those younger than fully developmentally matured.
All right, by all means, I totally understand that. I will check that study out when I get the chance. So you passed the test on 2 occasions now. The next issue though I have is, I noticed there was no within subject analysis, maybe in the form of like t-test or something. Is there any kind of difference or variation between your demographic variables, such as like your gender or your age groups? Because that could certainly affect the significant differences you got later in your study. I noticed you didn't include those in your paper.
Yes, that's an interesting point that you bring up. However, I'll restate that there was careful control and matching between the subject group and the control group, as well as the fact that if there was significant variation within these groups, the standard deviation may show that, and therefore it'd be much harder to get significant results in the between group analysis.
Okay. I can go with that. You're doing a very good job. You do know that my pass rate for reviewing is around 5.96%. I like to keep it fairly low. So.
Well, I'm an overachiever.
Oh, okay. All right. Well, we will see. The next issue I have though is involves Cohen's d, or effect sizes. You may have heard of the topic before. I noticed that there was, with your fractal scaling exponent, alpha, there's a large standard deviation compared to the difference between the 2 means. Specifically here, as you can see in your depressed patients and healthy patients, in the activity specifically of the left hand, I noticed. Do you have anything to say about that? Have you looked at the math at all, or?
Yes, I see visually that can be a bit concerning. However, let's do the math. It's fairly simple. So using Cohen's d, we just take the difference between the means of the 2 groups and divide it by the pool standard deviations. As you can see, that's what we did here, and we get a d of 1.5. So according to the standard chart, we see that that is considered extremely large, and therefore the result is indeed extremely significant. So we're safe in that area.
Say no more. Going on, I noticed that you had multiple dependent variables. So my question to you is, why would you not use something like a multivariate analysis of variance instead of the multiple t-tests that you used in your study? Because it seems like you could determine a difference between your independent groups more so than like with your dependent variables. It's also harder to get like a false positive or the type 1 error like you were talking about earlier, because it raises the p-value when you do it this way as opposed to your individual multiple t-test.
That is true. I could definitely use a MANOVA. However, individual t-tests are perfectly valid if we do show that consistent difference between groups. And so as you can see in the results, there's a significant increase in fractal exponent as well as decrease in the other 3 variables regarding motor activity, ultimately all coming to the same conclusion that there's a general slowness and motor retardation in those with major depression.
All right, I think I'll give you a half check on that one because I'm not totally sure I buy that explanation, but I can understand how if your multiple t-tests that you've done have shown significant differences, that maybe it would work as opposed to using a MANOVA. But I do think both cases could certainly work. The last issue I have with your study is the lack of baseline activity, mainly for your major depressive patients, especially with the motor activity for these patients. my main issue being like, how do you know that, I guess this is the kind of the classic case of which came first, the chicken or the egg. I know there was a study again by our colleague Hugh et al. Who measured baseline activity for dementia patients. And I know his study was more of a longitudinal study, and that's kind of more of a disease or a disorder that you can look at how it progresses and measure that as it goes along, as opposed to major depression. But I still, I'm unsure that when you have this issue with motor activity for major depression, is it something that maybe these people are predisposed to this genetically?
I see your point. We did have that question of whether or not this was a preliminary indicator of someone being more vulnerable to developing major depression. However, as nice as baseline measurements would be, it's really quite impossible. As you can see, we cannot really predict the future of whether or not someone can develop major depression, and therefore can't take that baseline activity in which they're normal. Nor would it be ethical to, I guess you could say, induce major depression. So yes, again, while that would be reassuring to have those measurements, in the scope of the study, that's not.
Perhaps that's something people could maybe look for in the future. Certainly, obviously, you cannot induce major depression. That would not be ethically or morally responsible. But that would be an interesting topic for someone to look at. Maybe one of the colleagues in your field to look at that in the future. So, all right, Dr. Thompson, I think you've put together a great work here. I'm very pleased. This is the end of your review. Congratulations, you've made it.
Thank you very much.